If you have recently been diagnosed with lipedema or have a lipedema diagnosis, or maybe you haven't found a specialist who understands what lipedema is and hasn't given you the diagnosis, but you totally know that you have this adipose fat disorder, today I'm sharing with you my beginner's guide to lipedema. This is basically like a lipedema 101 tutorial. I'm going to share with you 7 essential tips, techniques, and practical care resources for you if you are a patient with lipedema or you think you have it, or maybe somebody you know or love has lipedema. These tactics and tips are what I convey to my lipedema patients every day, and I'm so excited to share these with you here. Lipedema can be a very frustrating diagnosis. It can be a very frustrating disease to live with, and it can be absolutely frustrating as a lipedema patient to find information on how to take care of your body and your skin, what to eat, all the things that you need to do to care for this progressive fat disorder. And so that's what I'm here to do. I'm going to share with you 7 tips that are going to help you in managing your lipedema and also helping minimize some of the symptoms and the overwhelm and just the angst that lipedema can cause, from immobility to pain and even wounds and infections of the skin. Number 1, let's talk about food, let's talk about diet. It's recommended that patients with lipedema choose a low inflammatory lifestyle. So low inflammatory diet consists of eliminating a lot of the comforty foods, a lot of the sugars and the starchy foods, the carb-dense foods, preservatives, dyes. We need to be cleaner in what we're eating to lower the inflammatory state of the body that then triggers this adipose tissue production. It's an overwhelm of fat accumulation. Now, keto and going low carb does not address the adipose tissue that is overwhelming your body and growing at a significant rate that is hard to burn and hard to maintain. Now, lipedema fat is not a burnable fat, but choosing low carb is anti-inflammatory, and choosing a keto type of lifestyle can actually burn the fat you are able to burn that then limits the overall fat burden within your body. So this is absolutely key. You also want to choose anti-inflammatory liquids. So monitor and make sure that everything you're consuming in your body, intaking through food and liquid, your diet, is anti-inflammatory, as well as also things in your environment, skin care, hair care, nail care, all that good stuff. Now, my second tip is to actually build up more muscle tone. Do some strength training. And depending on your staging in lipedema and depending on your mobility, this might be limited. But even your own body weight, just walking around if you have a walker or walking to your mailbox back and forth or getting in a pool, which is great, that can help build strength. And we want to build more muscle tone because the muscle actually can help us contain and create more shapely limbs, particularly the lower limbs. Strength training also helps offset some of the joint immobility and some of the fluid that might be retaining around your knees or your ankles. So strength training is a long-term focus in terms of keeping your mobility high, as well as helping support the fluid, the blood flow, the blood circulation, and help support the lymphatic flow of your body. Now, third, I recommend choosing low-impact cardio. Like I mentioned, getting in a pool. You can do strength training in the pool, but you can also do cardio that is gentle. Choosing low-impact cardio is helpful in also moving the circulation and blood flow and reducing swelling in your joints, swelling within your lymphatic system, and also swelling of the actual adipose cells, the fat cells. So aiming for 21 minutes a day of low-impact cardio is really key. Sometimes that means parking far away if you're going to a shopping center or shopping mall, or making several loops around your grocery store, or walking back and forth from your mailbox, or walking your neighborhood blocks. Whatever is comfortable for you, you want to get out and make sure you are doing low impact cardio. Number 4, an absolute critical essential tip here is to wear compression garments. Compression is containment. So we need containment so that the fat cells do not overwhelm your legs or your lower torso, your butt, your hips. This is the category where I see a lot of patients not being educated about the value and absolute critical importance of compression garment wear daily. And I also see patients forego compression garments either because of cost, fit, discomfort, which pain is a big part of it, and just feel like there's no effect. They're not seeing a change. And this is really important. We are dealing with a progressive disease. The limb will expand. The fat tissue is going to expand. But compression helps create containment, and compression can also create a more shapely leg. Depending, again, on your staging of lipedema, we need to maintain as much of the shape as we can to limit the burden on joints, particularly your knees, hips, and your ankles, and even your toes. So containing using compression garments are really important. I'll post some links down below of my favorite compression. Not all of the compression wear is what you probably think in your head, like stockings. We have wraps, we have certain pads that you can lay on, and even softer material that with your weight of the limb being on a bed or laying on a couch can help support. But compression is absolutely critical. I hope if there's one takeaway that you make sure you invest in and routinely replace every 6 months your compression garments. So get out, get sized, get fitted. Often my lipedema patients in the later stages need custom garments, and there's special fitters that will cater to your needs. Number 5 is really deploying healthy skincare. With lipedema, we often get folds of the fat in the skin, and often when there's a fat fold, moisture can get trapped in between these 2 points of skin, and we often will see infections like yeast infections, thrush, and I've even had some folks have MRSA, and even skin that opens where we have open wounds, oozing wounds, and even cellulitis as a diagnosis. So if you have skin folds, or maybe you've had cellulitis in the past, or maybe experienced kind of an odor or redness, itchiness to the skin, that's an indicator we need to reach for antimicrobial, antibacterial skin cleansing. So using a soap like a colloidal silver soap on your skin, and also moisturizing with colloidal silver is going to be really important for limiting infection and properly moisturizing the skin so we don't have any chafing or breaking of the skin that can be infected and that can cause wounds. I also recommend not using rough, abrasive washcloths and reaching for silk sponges. These are natural sponges that are super soft. We'll do what we need to do in gently exfoliating the skin, but not in a rough way where we open up the skin to be exposed to bacteria, especially if it's compressed and there's moisture in there. That could be the feeding ground that then triggers cellulitis, and you don't want that. My 6th tip here is something that I've had a practice that caters to this, and I've had a wellness center where we had multiple massage therapists, is practicing lymphatic massage on yourself, scheduling lymphatic massage at a practitioner's office that knows about lymphatic massage to help move and motivate the lymphatic system. It's not uncommon with lipedema patients as they progress in staging. They also will have a co-condition, a co-diagnosis called lipolymphedema. So it's the adipose tissue that is growing and overwhelming the body and the limbs. And part of that, as it's expanding out, it's also expanding inward. And it's starving, it's compressing and limiting the lymphatic flow that then triggers a lymphatic condition called lymphedema. So lipolymphedema is often a very common diagnosis for progressive lipedema. And my patients who have lipolymphedema really benefit from lymphatic massage. It can really help motivate the superficial lymph that sits right below the skin, helps alleviate a lot of the swelling in and around your ankles and your knees, and just really helps to ease a lot of the pain you experience because we're releasing the inflammation and moving it through the lymphatic so that the nerves are not charged up, and can often be the difference between being able to wear compression garments and not. So lymphatic massage care in a clinical setting is recommended, but also I have a ton of free resources and tactics and DIY tutorials on how to move your lymphatics at home. So I'll include my whole entire lymphatic playlist that you can watch and peruse. Make sure you save it. Make sure you like and follow my channel so you get updates on other lymphatic massage tutorials. But that is really important. And at minimum, once or twice a month, you want to have lymphatic massage, if not more frequently, depending on your case. And last and final, I want to invite you into my patient-focused Lipedema Care Masterclass. I've built a whole entire masterclass catering to you as a lipedema patient. And if you're a caregiver or even a nurse or a practitioner, I actually educate medical providers in caring for lipedema patients, whether it's wound care or compression garments or supporting diet and how to motivate the lymphatics and also how to limit the inflammatory state of this fat disorder. And there are also some other secondary diagnoses that you probably have that likely you weren't diagnosed with that might make greater sense in terms of its relation to the lipedema you're experiencing. But if you feel lost and you feel like you're on an island and you need resources, this masterclass is going to give you everything you need beyond just these 6 tips. But I'm really excited to share with you these powerful resources. As a beginner in terms of the world of lipedema, this will get you kicked off on the right care path so that you minimize a lot of the pitfalls that I see with patients and you limit some of the progression of this adipose disorder. So I look forward to seeing you on my masterclass, and for sure, make sure you hit that follow like button. If you have any specific questions about lipedema, or you want me to talk a little bit further about lipedema care or herbs for lipedema or skincare practices, let me know. Comment in the comment box below and I'll be sure to whip up a video just for you. Thanks for tuning in. I'll see you on our next video.